Welcome. My name is Hawk. I'm a senior environmental health fellow in the Center for Public Health Policy at the American Public Health Association. As part of the Year of Climate Change and Health webinar series, APHA is proud to co-sponsor this webinar with Johns Hopkins University Center for Livable Future. The series explores the connection between climate change and key areas of our health. The science is clear. Climate change is a serious threat to human health. It can affect our health in many ways, harming water supply, increasing vector-borne diseases, increasing extreme weather events. Vulnerable populations such as communities of color, elderly, young children, and impoverished, and those with chronic illness bear the greatest burden of injury, disease, death, and related to climate change. As APHA priority, we believe in the need for a strong climate change strategies and interventions that protect people's health, and public health communities play a critical role in doing so. Today's webinar, Climate Changes Health, How Climate is Changing Your Dinner Plans, will provide information on how climate change is impacting agriculture, food safety, and food security. But first, here are some housekeeping items. We will take questions at the end of the presentation. You can ask a question at any point during the webinar by entering it into the comment box on the bottom right of your screen. The slides and the webinar will be available shortly after today's presentation. Finally, a survey link will be distributed at the end of the Q&A. Please take a moment to fill out this short but important questionnaire. It will help us improve our future webinars in the series. This webinar is part of our Year of Climate Change and Health webinar series. The Year of Climate Change and Health is an APHA-led initiative with goals of increasing awareness of health impacts of climate change and mobilizing action on climate change. We have a different theme each month to highlight key topics as determined by our members and partners. July is Agriculture and Food Safety and Security Month. And August theme will be water quality. Please visit www.apha.org/climate to stay up to date on our Year of Climate Change and Health activities. I want to note that the activities each month are partnership driven. Each month, topic-specific partners come together to determine the month's activities. We would like you to get involved in the Year of Climate Change and Health. Whether partnerizing as individual or organization, your contribution is invaluable. Bronze partners help share information with their networks or make lifestyle changes. Silver partners assist in planning monthly activities or utilize energy-saving features. And gold partners participate in silver or bronze activities, along with hosting a meeting themed on climate change or writing letters to editors. Follow the conversation on social media using the hashtag APHAwebinar and hashtag Climate Changes Health. For more information on how climate change impacts health, please visit www.apha.org/climate and view other webinars on climate change, including Climate Changes Health, Community Design and Transportation, Clean Energy Changes Climate, and Climate Justice Changes Health, local, tribal, global, and generational. Without further ado, I'd like to introduce our moderator, Irena Gorski, an environmental health researcher. Irena is currently a research assistant at the Center for Livable Future and a PhD student in environmental health at Johns Hopkins Bloomberg School of Public Health, focused on addressing food waste, climate change, and fracking. She is also the co-chair of APHA's Food and Environmental Working Group. Irena, I'll turn it over to you.
Thank you, Hawk. And thank you to APHA and the Center for Livable Future for hosting this webinar. I'm excited to be moderating this webinar both as a member of APHA and as a research assistant for the Center for Livable Future. For those of you interested in further discussing and working on the areas discussed in this webinar, you should check out APHA's Food and Environment Working Group. We are a dynamic group of professionals and students committed to improving public health through a more just, sustainable, and healthy food system. We always host a tour at the annual meeting and work with APHA staff on policy issues throughout the year. We focus on the intersection of food and environmental issues and opportunities, including but not limited to reducing food waste, minimizing the threat of antibiotic resistance from animal agriculture, shifting toward a more sustainable food system, minimizing the contribution of agriculture to climate change, improving food safety, and protecting bees and humans from the threat of pesticides. We're always looking for new members because our capacity depends on the people that are involved. And join us. If you'd like more information, are interested in joining, or would like to buy a ticket to the Food Systems Tour, please email me at irenagorski@gmail.com. You can also check out our Twitter page with the handle @FoodEnvironment. At this time, I'd like to introduce our first speaker. Her name is Allison Crimmins, and she was the lead author and lead coordinator of the U.S. Global Change Research Program's Assessment on Climate Change and Human Health. She is an environmental scientist in EPA's Office of Air and Radiation Climate Change Division and specializes in climate change risks and impacts. In addition to her work on climate change and human health, Allison is a co-lead on EPA's Climate Impacts and Risk Analysis Project, which quantifies economic benefits of global mitigation to the U.S. She is also an author on EPA's Climate Change Indicators Project. Prior to joining EPA, she worked at MIT's Joint Program on the Science and Policy of Global Change and has a Master of Science in Oceanography from San Francisco State University and a Master in Public Policy from the Harvard Kennedy School. This is a reminder that we encourage participants to send any questions to the chat feature in Zoom, and we will ask them after the final presentation. Thank you. Allison, you have the floor.
Great, thank you. Can everyone hear me and see my slides?
Yeah, we can hear you, Allison.
Okay, great. All right, thank you for having me for this webinar. It's been a great series. I've made a couple other webinars and events this year in this year of climate, and it's wonderful that APHA and its partners are focusing on such an important public health topic. So I'm just going to briefly walk through the 4 key findings that came out of the U.S. Climate and Health Report, which was released last summer. And specifically, I'm going to be looking at the chapter on food safety, nutrition, and distribution. If you are interested in all of the other topics covered in this report, air quality, vector-borne, waterborne, heat health, those sorts of other topics, the URL for the full report is in the bottom right corner of my slide here. And I'd really encourage you to take a look at this site. There's a lot of nice interactive graphics and figures and chapters and PowerPoint presentations that can be downloaded, executive summaries in English and Spanish, that sort of thing. But I'm just going to focus on this one chapter, chapter 7. And I'll start with a definition of food security. There are many definitions, but this is the one that we used in the report I'm speaking on, as well as the report that's shown here on the right. So this, just to read from the screen here, food security is permanent access to sufficient, safe, and nutritious food supply needed to maintain an active and healthy lifestyle. And I've highlighted that part of this definition, the sufficient, permanent access to sufficient food supply, is really covered in another report that came out of USDA in December of 2015. So that report covers things like impacts on yield, food prices, and trade. I'm focusing on just the safe and nutritious part of this definition in my talk here. So our chapter looked at 2 main drivers of the impacts of climate change on food safety and nutrition. The first of those is the impact of rising temperatures and changes in weather patterns. And we found that current and anticipated changes in climate and the physical environment will have consequences for contamination, spoilage, and disruption to the food distribution system. The other driver that we looked at is rising CO2 levels, known as CO2 fertilization. and the effect of that on plant photosynthesis. So again, not from a yield or supply angle, which is covered by that other report out of USDA, but the effect of rising CO2 on nutrition. So there are many ways that climate change can affect food safety. I've listed a couple here on this slide. Things like higher temperatures, which can increase the number of pathogens already present on produce and seafood. We know that bacterial populations can increase during food storage depending on the temperature and can affect the spoilage rates. We also know that precipitation has been a factor in the contamination of irrigation water and produce, which has been linked to foodborne illness outbreaks. And then things like extreme weather events, especially flooding, but other events like dust storms, which can introduce toxins to crops during development. Basically, all of these things listed here really point at that our food system is vulnerable to climate change impacts all along the different points of the distribution system. So prior, during, after harvest, during the transport, the storage, even in terms of food preparation and consumption at the very end of that, I guess, farm to table chain. So the first key finding from the report looked at the increased risk of foodborne illness, especially from rising temperature and humidity and extreme weather events. And we found that these impacts will affect the fate, the transport, transmission, viability, and multiplication rate of pathogens in the food chain. So if you look at the image on the right here, we're looking at seasonality of several foodborne pathogens, and you'll see the months along the x-axis. And so you can see an increase in many of these pathogens that thrive in warm, humid conditions, like E. coli, salmonella. There may also be an increase in outdoor activities in these summer months in June, July, August. So you may see more barbecues and picnics, which could also help explain this summer peak. The bottom right corner, the one that's not like the others, is the norovirus, which is the main cause of stomach flu. And you actually see a decrease in norovirus infection in the winter months, or I'm sorry, the summer months, a decrease in the summer months. And as we see warmer temperatures, we may actually expect to see a decrease in norovirus in these because of these warmer winters. However, norovirus is also affected by floods, and so we may actually see elevated transmission during floods. So the impact of climate change kind of goes both ways on this one. It's important to note before I move from this slide that what we're talking about here in terms of increased risk of foodborne illness is exposure. It's not the actual health outcome. So we know that climate change will increase the risk of getting sick. It will potentially increase the exposure in some cases, but that doesn't necessarily mean there'll be an increase in foodborne illness cases. We have a very strong system in the US that safeguards our food. And so what we're talking about here is really a change in risk. The second key finding from this report was on environmental contaminants. And there's a number of these polychlorinated biphenyls, persistent organic pollutants, dioxins, pesticides, other heavy metals, these sorts of contaminants that can pose a potential threat to human health when they enter the food chain. And we especially are expecting to see increases of these surrounding extreme events, things like heavy precipitation and flooding events. For example, after Hurricane Katrina, the floodwaters that were resulting from Hurricane Katrina contained many contaminants like spilled oil, pesticides, heavy metals, and other hazardous waste. And so this can also increase one's exposure and risk, although not necessarily incidence of illness, because that depends on a lot of other factors. One other example here that I'll show in this picture is some extensive flooding near a cattle farm, and you can imagine how that can introduce a lot of contaminants into floodwaters that people may come in contact with. The third key finding is one that I think is very well studied, but not very well known. A lot of people were surprised when we presented this finding, which is that rising carbon dioxide levels lowers the nutritional value of food. This is a finding that's based on that second driver of impacts on food, which is the CO2 fertilization effect. And so we see two distinct effects of rising CO2. The first is that increases in the concentration of atmospheric CO2 will also increase carbohydrate accumulation in plant tissues, which can in turn dilute the content of other nutrients. And the other distinct effect is that high CO2 concentrations reduce plant demands for water. So we see fewer nutrients being drawn into the plant roots. So I've highlighted three main nutritional impacts here. The first is protein. We see a decrease in protein concentrations at higher atmospheric carbon dioxide concentrations. And that is shown in the top figure on the right there, which looks at wheat flour and the effect of rising CO2 on protein content in that flour, which basically means that the piece of bread you're eating today will not have the same nutrient content of a piece of bread that's eaten later in this century. At the same time, protein is decreasing, we see a rise in carbohydrates. So that ratio of protein to carbohydrates is going down. And that can be important in developing countries where there's a protein deficiency, but the flip side of that is also very important in countries like the United States where we have obesity concerns. The last point I'll make on this slide is that it's not just protein and carbohydrates. We actually see a lowering of many different essential micronutrients, which is shown on the bottom right there. We see decreases in potassium and calcium and nitrogen and iron in lots of other minerals in our different important agricultural crops, especially the C-type crops. So my last slide is on our fourth key finding, which looked at the impacts of extreme weather on food distribution. And we found that from anecdotally, but also projections, that we're expecting increased disruptions to the food distribution system here in the United States. And the example that I've highlighted in the picture and the figure on the right is in 2012, we actually had one of the most severe summer droughts the nation has ever seen, and that posed some serious impacts to the Mississippi River watershed, which in the US is a major transcontinental shipping route for Midwestern agricultural products. And you can see that arrow at the bottom where the 2000 drought was touching on the minimum operating limit at the St. Louis station. And then, of course, following that 2000 drought, immediately following it, was flooding throughout Mississippi in the spring of 2013, which also resulted in disruptions of barge traffic and food transport. You can see that crossing over the flood stage in the upper arrow in that bottom right figure as well. And so these swings in precipitation from drought to flooding, these are consistent with the projected increases in the frequency and severity of different types of extreme weather events that we expect to see more of under climate change. So I will stop there and turn it over to the next speaker. Thank you.
All right. Thank you for that excellent presentation, Allison. We look forward to hearing from you again during the Q&A period. Our next speaker is Becca Klein Bartholomew. Becca is a consultant to Friends of the Earth's Food and Technology Program, which is helping to lead a groundswell of action focused on building a sustainable, healthy, and equitable food system for all. A strategist and facilitator with a background in organizational development, Becca has extensive experience managing coalitions and forging relationships among public health professionals and food and agriculture policy advocates. Prior to consulting, Becca spent over 5 years with the Johns Hopkins Center for Livable Future. Again, we encourage participants to send any questions to the chat feature in Zoom, and we'll ask them after the final presentation. Thank you. Becca, you have the floor.
Thank you, Irena, and thank you to APHA for the invitation to be here. It's an honor to present on this important topic amongst my distinguished colleagues. I am going to discuss impact of food of food choices and food production on climate change, and some solutions to addressing this impact. I want to build on what Allison was saying about food security by reminding us of the quote from the 2015 Dietary Guidelines Advisory Committee. They said, quote, "Linking health, dietary guidance, and the environment will promote human health and the sustainability of natural resources and ensure current and long-term food security. The availability and acceptability of healthy and sustainable food choices will be necessary to attain food security for the US population over time," end quote. In other words, what we eat and how that food is produced will have significant impacts on sustainability and future food access. My remarks will focus on animal agriculture because, as you will see, increasing our consumption of plant-based foods and reducing meat and dairy not only has huge benefits for mitigating climate change, it's necessary to avert catastrophic climate change. So overconsumption of meat and industrial meat production and dairy production are at the center of some of the world's greatest ecological and public health threats. Deforestation, biodiversity loss, water scarcity, water pollution, diet-related disease, antibiotic resistance, intolerable animal cruelty, and more. We cannot solve these problems unless we dramatically reduce meat consumption, reform current animal agriculture practices, shift to more sustainable livestock production. As the Intergovernmental Panel on Climate Change has pointed out, quote, "Changes in human diet can have a significant impact on greenhouse gas emissions, and the potential to reduce greenhouse gas emissions through changes in consumption that includes some meat, fish, and eggs was found to be substantially higher than that of technical mitigation measures." So we focus on reducing animal products when at the role of diet on greenhouse gas emissions for the reasons that this graph illustrates. Most animal foods, especially ruminant animals such as beef and lamb, have significantly higher carbon footprints. And just how big is the footprint from livestock? Bigger than that of all tailpipe emissions from all vehicles across the globe. 14.5% of total greenhouse gas emissions globally. In fact, if all of the livestock of the world were to form a nation, it'd be the third largest greenhouse gas emitter after China and the US. Where are these emissions coming from? The majority comes from livestock releasing gas. Yes, burping, farting, though mostly burping, as they digest. The other major sources are their manure and the crops used to feed them. As you can see, meat has a huge carbon footprint. I want to add one more layer before we talk about solutions, or as Tina Turner might have said, what's waste got to do with it? 40% of food is wasted in the US. 30% of food is wasted globally. It's especially important to think about this in the context of animal products, because while only about 13% of global food waste comes from animal products, due to the resources needed to produce them, wasted animal products contribute to about a third of food waste's greenhouse gas emissions. Here's why this is all important. And if you pay attention to any part of what I have to say today, this slide is the most important part. Via the Paris Agreement, world leaders have set a goal of limiting global mean temperature rise to no more than 2 degrees Celsius above pre-industrial levels. And even 2 degrees Celsius is projected to have major global impacts. Yet, as warming rises above that level, the likelihood of severe and irreversible consequences significantly increases. These 2 degrees are referred to as a threshold. And if you look at this graph, if meat consumption continues to increase as trends are showing, the entire 2-degree threshold will be taken up by emissions from meat, the entire 2-degree threshold. That means efforts around efficient transportation, solar panels, clean energy, etc., will all be for naught if we don't also shift diets. So, is shifting diets possible? We believe it is, and relatively small changes can have huge impacts. For example, Friends of the Earth recently analyzed shifts made by Oakland Unified School District. The district made some changes in its menu, reduced total meat purchased, and spent more dollars on sustainably produced foods. The total meat served went down 30% over the 2-year period, and they saved 42 million gallons of water, reduced their carbon footprint by 14%, and saved $42,000. Studies have modeled the impacts of diet shifts. For example, this 2016 analysis on the valuation of health and climate change co-benefits of global dietary change showed that benefits increased the more plants were part of the diet. But even shifting to a healthier diet, one based on potential global dietary guidelines, showed benefit. So given the lack of federal leadership around climate change, many of us are turning to municipalities to lead on addressing it. And many cities have been stepping forward to align with the Paris Climate Agreement. To support this important work, Friends of the Earth is developing a guide for municipalities focused on food procurement that achieves the triple bottom line of increased healthful food offerings, reduced environmental impact and climate impacts, and increases cost savings. The guide will feature example policy and example contract language, specifics assessing who needs to be involved and how to make these important changes. It'll include examples of important work that is already happening. Example, a handful of cities and counties have included meat reduction already in their climate action plans. Some cities have adopted Meatless Monday resolutions, and we hope this guide will inspire every municipality to address food procurement as part of their climate change strategy. Finally, I want to be sure to remind us to consider how food is produced. In addition to the need to reduce animal foods, whenever possible, we should be selecting foods produced in ways that preserve, restore, or enhance ecosystems. One effort Friends of the Earth is doing to help us toward that goal is called the Better Burger Challenge. We're working with universities and other institutional settings like business campuses to transform the classic American food. The idea is to take the blended burger, which is 70% beef and 30% mushrooms, and use the cost savings from reducing the total meat to purchase better meat. For vegetarians, there's also the Better Veggie Burger, which is made of organically produced vegetables. These are just a few of the things that can be done to shift diets, and I hope that each of you will use your seats as public health professionals to advocate for and make these essential shifts in institutional food procurement and dietary choice. Thank you for your time. I look forward to the discussion.
Thank you, Becca. And look forward to hearing from you again during the Q&A portion. Our next speaker is Dr. Ronnie Neff. Dr. Neff works for the Center for Livable Future, an academic center that focuses on food systems and public health. The center performs research and engages in policy, practice, and communications. They also have opportunities for students, including a new MPH concentration on food systems and health, a food systems certificate, and doctoral fellowships. Dr. Neff directs the Center for Livable Future's Food System Sustainability and Public Health Program and is an assistant professor in the Bloomberg School's Environmental Health Sciences Department, as well as the Health Policy and Management Department. Her work focuses on food system sustainability and resilience. She is engaged in multiple research projects on the issue of wasted food. Other topics of interest include farm policy, climate change and food system resilience, food system worker health, meat consumption, and framing connections between food systems and public health. Ronnie developed the first ever textbook on food systems and public health on behalf of the Center for a Livable Future. Please remember that you can submit your questions through the Q&A feature, and we will ask them after the presentation. My apologies, the chat feature, and we'll ask them after the final presentation. Thank you. Dr. Neff, you have the floor.
Thank you, and it's a pleasure to have the chance to talk today on this webinar. So my talk builds on some of what Becca was saying about cities and some of what Allison was saying about climate change adaptation. And I'm going to be speaking about urban food system resilience, although it's not just for cities. This work builds from work that we are on a report that we're about to release in conjunction with Baltimore City on August 2nd, so stay tuned for that. And the research was led by Erin Beal and Baltimore City colleagues with me and overseeing it. Uh-oh, we're not advancing. There we go. Okay, so let me start by defining food system resilience and defining resilience, which is the ability to absorb, respond to, recover from, and adapt more successfully to adverse events. And if you think of that first horizontal black line going across, that's our food system. We hit some shock. And then how far down we go is a matter of how much resistance there is in the system that prevents us from going too far down. And then the resilience is that recovery phase to what is often a new normal rather than the original normal. And I should say that we worked closely with Baltimore to develop this plan. We're one of the first cities in the country to start looking at this. There are a few others that have started. And this, we see this as a really critical direction for city food system work and for food system work in general. So the concept that we have for the things that will affect a food system's resilience and ability to function are some combination of the state of the existing system, the hazard and the magnitude of impact of whatever hazard we face. And this report addressed not only hazards from climate change, but other ones as well. The level of vulnerability in the system and the ways that various parts of the system could be impacted, and then the existing preparedness and response activities. And so we did a lot of mapping. We did a whole set of qualitative interviews. We were at community forums, things like that, to gather data for this food system resilience assessment. So how would climate change affect a city's food system? Well, extreme weather can affect building and road damage and closures. It can cut off electricity and communications. If there's change, when there's change in precipitation and weather patterns, and things like conflict can affect food availability, affordability, and quality. This is a graphic from Mother Jones, but it's taken from USDA data, and it shows that a lot of the major fruit, vegetable, and nut crops that we have are produced in some of the areas of the country with the greatest drought, and even if that's temporarily moderated, it is expected to come back. And as we think about and globally speaking, that's true as well, that a lot of our food sources, we have a very diversified global food system, but a lot of foods are primarily produced in particular areas. And if something happens to one food type, that can often have huge ramifications for prices and availability throughout the global food system. And climate change can also exacerbate inequities in the existing level of inequities in a food system. And that's important because if we think about, we want to increase resilience of the food system because we want to improve food security, well, we all know the reality, like in a city like Baltimore, we've already got a quarter of the city food insecure, a quarter of the city with low healthy food access. So, so we have to be concerned about those situations getting even worse. So let me drill a little deeper in terms of what are some of the more specific challenges for a city like Baltimore. So people with lower incomes may face challenges in terms of storing emergency food supplies, like a 3-day supply. If you need food, you might want to eat that food instead, or easily restocking if your food supply is damaged. Grocery stores, benefits, credit cards, all rely on computers and electricity. If those are out, then that could really mess up procurement and the ability to get food to people. Public schools in the city provide lunch to 60,000 students. When the schools are closed due to, for example, an extreme snowstorm, then those students are going to have a difficulty getting food. Public transit lacks reliability and redundancy. Redundancy is really important in resilience in terms of the ability to have multiple ways of getting to the same place and doing the same thing. Diversity is also important in resilience, the idea that you need a lot of potential backups if something goes wrong. And we have a food system that's fairly diversified, but if something were to happen that were to prevent food from getting into the city, we know that our local food system and local food systems pretty much everywhere would not be sufficient. So we need to continue maintaining diversity and building local, but also strengthening diversity in general. And then small businesses and nonprofits often lack resources to prepare adequately, and they also may lack exactly the know-how for what they need to do. So we did these qualitative interviews. Here's an example from an independent grocery store owner who said, for you to have a generator that can actually run the refrigeration in the store costs about $500,000. and then you got to pay about $10,000 of your service contract. So I usually take the other position. I generally buy insurance and try to cover my loss with insurance instead of trying to plan around it with a generator. And from a church leader, another type of challenge we heard, if the volunteers can't get here, then we can't do the food pantry. And 90% of the volunteers are seniors. So again, if you've got a snowstorm, a lot of slippery sidewalks and roads, that's a problem. We also were very concerned with recognizing the things that that people are doing well in coping already with challenges that we face and in preparedness. So for example, a community member says, in a Black community and in other communities of color and in poor communities, a lot of times we're already in states of emergency even before the weather happens. So we figure out ways to be resourceful and to lean on one another to ensure that the community is fed. And here's a quote from a corporate manager for a supermarket chain saying, your bigger players, like the other large chain stores, they have similar plans too. They have too much at risk if they don't. So a lot of preparedness and resilience and support is coming from within the community. Briefly, I want to just share, we worked with engineers to create what's known as a fault tree, which involves creating indicators of potential ways that a food system could fail, which could then be useful to city planners. And so we looked at 3 ways that the city could fail. The food system could fail: food not accessible, not available, or not acceptable. And then we went down from each of these into a whole lot of reasons and sub-reasons and sub-reasons why that could happen. All the circles at the bottom are terminal events. An example of one is roads severely damaged. And so you can set a criterion like what percentage of the roads being severely damaged would be the extent to which you would say that would lead to a food system failure. So ultimately, we work with the city. We developed 36 strategies for improving resilience. I want to just briefly summarize a few of them. One is enhance redundancy and diversity in the food supply chain. And they're also developing backup community-based food storage. Support small business and nonprofit preparedness capabilities. Build community resilience. So the city cannot be everywhere in the face of a disaster, so we need communities to be able to support each other. Connect to broader planning efforts for resilience, transportation, waste removal, and so on. Obviously involves stakeholders from every level. And then there's a whole set of no regret actions that address existing limitations in economic and physical food access and strengthen the food system generally. So ultimately, what if it's a big hoax and we create a better world for nothing? That's where we're headed. And I think that it is not a big hoax, and we do have an obligation to work jointly with cities around the country and globally to plan for food system threats. Thank you.
All right, thank you for sharing that with us, Ronnie. And our final speaker is Janie Sims-Hipp. Janie is the founding director of the Indigenous Food and Agriculture Initiative at the Arkansas School of Law. She is an enrolled member of the Chickasaw Nation, and prior to launching the initiative, she served in the Obama administration as the senior advisor for tribal relations to Secretary Tom Vilsack. And prior to her appointment within the Office of the Secretary, she served in the National Institute of Food and Agriculture at the USDA as the National Program Leader for Farm Financial Management, Risk Management Education, Trade Adjustment Assistance, and the Beginning Farmer and Rancher Development Program. She also served at USDA Risk Management Agency as the Risk Management Education Director. Prior to her work in DC at the national level, she has had a long career in the field of agriculture and food law. She has been a licensed attorney in Oklahoma for more than 30 years and specializes in food and agriculture law and Indian law. Janie, you have the floor.
Can you hear me?
Yes, we can.
Oh, great. Great. And I'm assuming that you're going to advance the slides. I'm not seeing it.
Yes, we have it.
Great. If you could just move on to the next slide. I'm going to be covering some issues in a slightly different context than some of our other speakers today, because for many Native communities, and you'll see the slide before you, which is the census map that's put out ever so often. This one has not changed dramatically over time because you are looking at a picture of what we refer to under federal terminology as Indian country. It also incorporates, you'll see in the very top corner, Alaska, and some of my examples today are going to come from what is already being experienced on the ground in Alaska, but also the lower 48 reservation and tribal communities, which at this point are already in the crosshairs of specific climate change impacts and are already experiencing food safety and foodborne illness, as well as food insecurity issues directly related to climate, but also related to failures in the distribution system of food that the rest of the country already takes advantage of, so to speak. Next slide, please. There are 5.2 million American Indians and Alaska Natives. Those census numbers are on the rise. Approximately 1.1 million live on or near reservations or native lands. About 70% live in urban settings at this point, but have deep connections to the land base that constitutes Indian country, which literally sits over about 34 states in the U.S. Tribal lands include approximately 56 million acres, about 3% of U.S. lands in the lower 48, and about an additional 44 million acres in Alaska's land base held by Alaska Native corporations who work directly and represent directly Alaska Native villages, of which there are 229 federally recognized villages in Alaska alone. Most reservations, with the exception of some in the upper Great Plains and obviously Navajo, are fairly small, but some can be millions of acres as well. Distribution of our population, obviously, I mentioned earlier, is approximately 70% in urban areas. However, the distribution around some of these rural, reservation, remote, and isolated communities can be quite high. At this point, according to USDA data, about 25% on average of all Native peoples use one or more of the federal feeding program's safety net for food access. And in some communities, that percentage can reach as high as 60 to 80% usage. Therefore, and it's particularly pronounced in Alaska, but it also exists throughout the lower 48 tribal areas. Subsistence is vital to food security, and subsistence practices are likewise protected not only under federal law, tribal law, but also international conventions and treaties. Next slide. I'm going to go through very quickly some slides that help me. I hope they help the listeners and the folks participating today. Really kind of get a sense of who and where we are and some of the data points that can apply to a discussion of food and agriculture, as well as food access and health in Indian country. This map shows the percentage of American Indian and Alaska Native. You can see the concentration if you relate it back to the other map of Indian country itself. Our populations tend to exist in some key, very short number of urban areas, but also tied very much to our lands. Next slide. If you actually sit this slide alongside the first slide I showed you, which was Indian country according to the census data, or the census maps, the unemployment rates in those areas can be quite profound. Again, you do see a tracking of use of feeding programs to unemployment rates. Where you have high use of feeding programs, you also usually have high unemployment. And it's not a question of folks being unwilling or unready to work. There are literally no jobs in those places at all, or there are jobs that are directly tied to agricultural production by tribes, by tribal members, by tribal governments on tribal lands. Next slide. Again, rural counties tend to be where we are as well. Next slide. And I would say in most circumstances, tribes and tribal headquarters, our lands tend to be not just rural, but remote and isolated. We also tend to have a high number of tribes that are headquartered and or their lands are located around farming dependent counties in the US. So if you start to talk about food and agriculture policy without talking about the impacts on tribal culture, tribal rights, as well as protections that are afforded tribal governments as political entities, then you can't get very far. You've got to talk about them in context with one another. Next slide. I did throw this persistent poverty counties in because these persistent poverty areas around the country also tend to track alongside not only Indian country, but also persistent African American poverty areas, as well as the Appalachian areas of this country. You can see a direct overlay of some reservation lands specifically on this map. Next slide. I did throw in this as well. This is one of the classic kind of early food desert maps. I know a lot of folks who prefer not to use the word food desert, but I'm going to still use it for a while longer because the map really does show you that this lack of access to food is real, and it's real in very clear context related to Indian country. When I was at USDA as senior advisor to the secretary, I actually asked Economic Research Service to do a complete overlay of any food desert locations with Indian country political boundaries, and it was a complete overlap. Next slide. Same here as well. That's just another variation of the food desert mapping. And it will track tribal headquarters and tribal locations. Next slide. This slide, the FDPIR program, that is one of the feeding programs that is used by tribal members and tribal governments. This one actually is used by over half of all tribes use the commodity distribution or food distribution program. And you can actually see it's quite heavily used in areas where there is also a lot of agricultural production. Next slide. This slide I pulled from another source. You're welcome to study it at greater length at a later time, but tribes are already affected by climate change across the U.S. It is affecting our food sources, our subsistence food sources. It is also affecting our ability, not just in rising sea levels or impacts in Alaska, for instance, with permafrost and the like, but is also making itself known through sustained droughts that are much harder to mitigate where we are because resources literally do not stretch all the way to us. Next slide. We can go past this one. It really just shows that tribal members really are exist and live well beyond those kind of classic locations in Indian country. This slide also shows you how many tribes are deeply involved in climate change initiatives of various levels of development and deployment. You'll see a big cluster of those in Alaska because the impacts that are being felt up there are even more pronounced than they are in the lower 48. Next slide. So I guess the points I wanted to make today, and it's kind of hard to fit all of this into a small amount of time, but we're already seeing in Indian country forest impacts, fire impacts, food impacts, water quality and quantity problems, declining sea ice and thawing of the permafrost, prolonged droughts. And I forgot to add, but I will add that in many cases, just as one of your previous presenters indicated, we've seen areas where we have profound droughts followed a couple of years later by profound blizzards and ice events, which can be just as devastating to remote and isolated rural reservation communities because the resources to get food in are significantly impacted in those kinds of circumstances. We are already seeing a relocation of Native communities. It's already occurring. In fact, USDA has actually helped in the relocation of communities under its rural development and other related authorities in environmental emergencies. And it's one of the few federal departments that actually has those kinds of capacities that it can utilize. Obviously, moving a community is an area of last resort, but when there is imminent danger to the community, USDA has actually been asked by Native communities to come in and help. Land use changes and land cover changes are happening, and the effects on the communities and ecosystems are reaching profound stages at this point. Next slide. This slide, I think, is important because it actually shows what some of the specific issues are in Alaska. Please know that of the 229 villages and all of the Native residents in Alaska, there are profound numbers who rely entirely on subsistence food sources, or predominantly. And that can be because of their remoteness, but it can also be because the sheer act of getting food to them that is not subsistence based, i.e. land mammals, shellfish, other fish, marine mammals, birds, wild plants, and salmon, is just too expensive. You all can probably relate to several horror stories that you've heard over your lives about how hard it is to get food into Alaska villages. And at this point, there are approximately 10 to 12 villages that are literally awaiting being named as potential food distribution sites because their subsistence foods have already changed migration patterns and are no longer available to them. So this idea that we're going to think about planning is not real for Native communities. We are already deeply affected and are already well past just planning. We are implementing all sorts of measures to try to deal with these issues. Next slide. And I'm going to go very quickly through these others. I do want to, I included this slide only to make the point, and there's a couple other slides that are behind it. The benefits of subsistence food sources, of wild animals, of wild game, of wild marine and terrestrial mammals is extremely prevalent in the scientific literature, as well as centuries and centuries of Native health practitioners. Traditional foods is what I'll refer to them right now, are very, very important to maintaining the health of Native peoples. Our bodies are set well to these foods from over tens of thousands of years of being acclimated to them. And so the climate change is affecting our access to those foods, which is in turn accessing being problematic to our health. Loss of culture is huge. And when we start to talk about policy interventions or community interventions, maintaining our culture is probably the most profound thing that we have to keep our eyes on and do everything we can to protect. Making policy changes that affect people in cities is not necessarily going to do anything other than wipe out the culture of Native peoples. So I always ask people when I'm in conversations such as this, that they should be extremely mindful of those issues. Next slide. And I think I'm close to the end. I'm just not going to go through this. I've indicated previously some very significant environmental changes that are already happening. Those are on your slides. Next slide. Health effects are already happening, not only to our food sources, but to us as well. Next slide. I think I've already covered this one as well. I don't want to take up too much more time. A couple of last two slides, and then I will shut it down. Policy interventions in this space tend to be isolated and tend to not be included in the mainstream conversations. And then when they are, no attention is actually paid to maintaining and preserving the culture of Native peoples. linking us to our traditional diets is going to improve our health as opposed to decline our health. We also need to be mindful that many Native communities are deeply tied to four-legged brothers and sisters, and to assume that moving to, for instance, a meatless Monday is going to improve our culture and our health is literally not the case. And so, being mindful of other people's cultures and traditions, not only in a way to preserve them, but to honor them and to respect them, is extremely important in these policy discussions. Financial resources are necessary to ensure adaptation in these remote communities. We have to pay attention to community engagement and contingency planning. What I have found in my time with the federal government is that there's very little contingency planning going on with regard to specific needs of Native communities. The science, nutrition, and health guidelines, the dietary guidelines, do not acknowledge tradition and subsistence foods and the better health impacts that Native people have when they are ramped up in access to and maintain the access to their traditional and subsistence foods. I've been in deep discussions with Food and Nutrition Service and USDA about these issues for years. Those guidelines literally tend to ignore the importance of traditional foods to maintaining Native health. Next slide. Engagement of our hunters and fishermen and our gatherers and our food businesses and our food people is critical. Tribal consultation is required under federal law and under international conventions and treaties. Prior informed consent is required in dealing with tribal communities and indigenous communities in these spaces. And it tends to be glossed over in policy discussions, but it is critical and important. Our tribal governments are political entities at the same as you would talk about a city or a state. Tribal governments deserve the same respect, and they're afforded that under the law. So maintaining consultation relationships with tribal leadership is extremely important when you're dealing with policy implications of climate change in our communities. And I would just say that one of the things that's often lost in this whole conversation is the intense and thousands of generations of traditional ecological knowledge and traditional food knowledge that is already embedded within our elders and within those who are knowledgeable of such things in our communities. And what many federal departments have already found out by partnering with tribes in a new way is that traditional knowledge can significantly lead the way in mitigation and as well as monitoring, as well as deployment of initiatives that could help all of us. So I'm just going to leave it with that. My last slide, I think, is my contact information. I'm glad to be on this today and appreciate the opportunity to discuss these issues. And I will definitely tune in to the tribal health one that you have later this year. Thanks.
Thank you for sharing that with us, Janie. We are now going to move to the Q&A session, but we are out of time. So we have copied down all of the questions submitted, and we'll be asking 2 of them right now to as we move over time, but the rest of them we will do our best to follow up with answers afterward. So as for these 2 questions, they apply to all of the speakers. And first of all, in a time of so many crises and demands on the concerns of public health professionals, how do we keep attention on these important but longer-term issues as well? This one is for any of the speakers who can chime in.
Can you ask it one more time?
Sure. So in a time of so many crises for the public health community, how do we keep attention on these more immediate term issues as well as longer term issues like the ones we've been talking about today and applying to climate change and other issues around agriculture in the future? How do we keep attention on the immediate crises as well as these longer term crises at the same time?
This is Ronnie, and I think one piece of it happens through unfortunate current events where things come about, and if we can be prepared in advance when something happens so that we can connect it to the things that we need to do to prepare, that's one strategy. There are many others. Another
Okay.
one is continually educating and speaking about the issues.
Okay, unless another speaker interrupts me, I'll move on to the other question. Considering technology has helped us in the past with many things, could some technology breakthrough in the future help us down the road?
This is Becca. Their technology is certainly jumping in pretty strongly on the plant-based food scene. Some of you may have seen, there's a lot of work being done to develop what hamburgers and meat that are made completely from plant-based items that taste just like what we would think of as meat. And so I think it can play a role in that. Maybe it can bring more people into trying plant-based foods, but so far I personally am not 100% convinced that it's the only way forward, because a lot of money is going into that. And imagine if we sort of turned that money around and we're able to invest it in public health or invest it in supporting farmers who are doing sustainable practices. And so my concern about technology is that it hasn't yet found a way to integrate across all communities and all income levels and sort of be an answer that helps everybody instead of certain niche populations where there's excitement and investment and potential for gains in the future.
This is Ronnie. I'll build on that. So I agree with what Becca said, and at the same time, I do see just this incredible opportunity with technology to address some of the biggest problems that we do face. It's not the answer, but it can really address, like from the resilience talk that I gave, for example, some of the cell phone technology that can enable various communications, self-driving cars, like there's all kinds of things that will be out there that are on the horizon that can make a big difference. But we've got to sort of pair that with lower tech interventions, and also, as Becca was saying, with real strong efforts to make sure to make that technology available to all.
All right, thank you. Are there any other speakers that want to chime in before I turn it over to Hawk to wrap up? Otherwise, thank you all for submitting your amazing questions, and we promise they have been heard, and we'll do our best to answer them following the webinar in the next few days. The webinar is also available online recording. All right, I'll turn it over to Hawk to wrap up. Thank you.
Thank you to our distinguished panel for sharing information on climate change's impacts on agriculture, food security, and food safety, and the resulting effects on our health. We also thank you and the audience for participating. We want to remind you that none of the year of climate change and health activities would be possible without partners. Please visit www.apha.org/climate to participate either as an individual or organizational partner. On behalf of American Public Health Association and the Johns Hopkins University Center for Livable Future, we appreciate your time and participation. This concludes the webinar. Thank you.